Well, I think healthcare engagement means you're actually taking the time to find out what's relevant to people, and you're learning that, and you're putting forward products and solutions to realize that on a consistent basis. So it's a move away from kind of a short-term campaign mentality to a longer-term establishing a really credible presence that you benefit from because you're delivering something that's relevant, that's linked to either product or service offering.
When I think about healthcare engagement, it's about the expectations we have for patients and the expectations they have for themselves. So a physician in the U.S. will go to school for maybe an extra 12 or 16 years to become a doctor. But unfortunately, nobody goes to school to be a patient. So I think it's an on-the-job training and an on-the-job discovery process for every person. It's different. Certainly people that are technically savvy, the younger, maybe people that have chronic conditions are more motivated to get information, connect with people, and become a real proactive part of their own health care. There are other people in my mother's generation that maybe still see the physician as really the primary and only source of information and treatment. And I think once again the world is it's big, it's changing, and I think we need to better define for patients what it means to be a patient and what the resources are and also what the responsibilities are, because I think we also talk about a patient bill of rights, which is certainly important when we talk about patient privacy and things like that, but there could also be a patient bill of responsibility. So, I am responsible for my own health care and that of my family.
I mean, to me, what's really important for us to understand is how many people are going online every day to find access to information that can help them make health decisions. And from the point of view of a company that makes, manufactures, and understands how to create products to help people manage those diseases, we have an opportunity now to become more involved in some of that decision making that takes place online. So when we talk about healthcare engagement on healthcare online, to me, it's being part of that conversation. What's really compelling is how many people not only go online for health information, but how many of those actually trust information from others like themselves. They're trusting information from other consumers more than they're trusting information that's being created by organizations, by companies, and from other members of industry. With that in mind, we need to be able to help people to make sure they get access to accurate, informative, and useful information. And that means that we have to learn how to start to talk and engage in ways that people are engaging with people like themselves.
Well, I think it's really about empowering patients to take control and manage their illness. So giving them the tools and the information they need to make the correct decision in partnership with their healthcare provider or physician, and really empowering them to have all of the information.
To me, healthcare engagement, I immediately think of patients and consumers taking control of everything. I mean, let's face it, we're in a consumer-oriented world. Consumer goods products have essentially grasped this already, and I think healthcare is soon to follow. So it's really patients taking control of their own health, navigating the complex systems that we've had to set up through managed care and other organizations. So to me, that's what immediately comes to mind.
Healthcare engagement, to me, means where throughout the continuum of health, everyone is engaged. The physician is engaged in the care that she is delivering. The technician who's doing blood work is engaged with what he's doing, making sure the patient is being put first, is placed first. But more than anything, healthcare engagement to me means that the consumer of the healthcare, the patient, and as well as their loved ones are 100% engaged in the process. For me, bottom line is that the consumer being engaged is healthcare engagement, and if the consumer is engaged, then inevitably better health is delivered.
For me, healthcare engagement means being able to reach the patients and the physician when and where they want the information.
Well, I can tell you what it's not. It's not browsing a website or quickly skimming a video or having a 2-second conversation with a rep. I mean, to me, if it's with the consumer, it's actually providing some value, educating, maybe entertaining, and then ultimately positioning your product toward the end of it. I don't think that with the healthcare providers is easy, but I think that we as an industry need to get back to the days where we're seen as an educational resource and you know, that we're doing something positive and adding value to that constituent before we hawk our own drugs. So, is that engagement? By definition of engage, which is used way broadly, you know, to refer from anything from I looked at a website to I commented to I watched a video, etc. To me, in its truest form, engagement means that they're attentive, they're leaning forward, they're absorbing information, their behavior, or at least their intent for positive behavior changes has been shifted. That would quantify, not brand. That's not engagement.
Well, okay, since I'm a guy that focuses on the pharmaceutical industry, there's a lot of talk about how pharmaceutical marketers or communicators can engage with patients and physicians online and through social media. So one of the things I think that is in healthcare engagement is to help patients with their problems, that in terms of supporting patients through social media. So to me, engagement means conversation, and it means helping patients not just understand your products, but helping them with their medical condition online as well. So maybe it's just something broader than the pharmaceutical industry, and I think these social media tools can be used by healthcare companies to great benefit.
You know, engagement was a word that we heard a lot over the past couple days, and I guess in my opinion it's that shift from the shotgun approach, mass communication, mass effort, to more customized communication, the two-way dialogue, all of those buzzwords again that we've been hearing, probably a lot of the same questions or answers you've been getting. But you know, I think it's a word that people use a little loosely and really don't think about it. So I appreciate the question, and I think it's one of the things that pharmas very specifically get a little afraid of. How do we, in a regulated environment, frankly, converse with our customers, and are we willing to listen to what they have to say?
Engagement is the difference between reaching up and catching something that's thrown at you and looking at it and just letting it bounce off of you. You know, in the old model of healthcare, it was something that was done to us. We'd go to the doctor, we'd get a shot, we'd be told what to do, and that would be the end of it. An engaged patient asks questions, gets involved, keeps track of how they're doing, and in general, they also speak up. That's the empowerment aspect of it. They're engaged in their care instead of being passive.